I'm Tina B, a labor and delivery nurse, and this is Fast Fact Friday, where I'm going to get you in and out of this video in under 5 minutes while still discussing topics that are really important to know about in pregnancy and childbirth. Today's video, we're tackling membrane sweeps. Let's do it. All right, what's a membrane sweep? A membrane sweep is very similar to a cervical exam with one very large difference. Your provider is going to take 1 or 2 gloved fingers, and they should be sterilely gloved because we are still inserting them into the vagina around the cervix, and that always does run a small risk of infection. They should be lubricated too. Please don't forget the lube. We're going to do a cervical exam, and that exam is going to tell us things like the position of your cervix and the consistency of your cervix, and if you're dilated or effaced or the station of the baby. But instead of stopping with just a cervical exam, they're then going to use those fingers to make a circular motion all the way around the cervix to try to separate that amniotic sac from the uterine wall. Now that amniotic sac, it contains your amniotic fluid and your baby, but why would we ever want to pull it away from the uterine wall? That's because when we do this, it releases something called prostaglandins. And prostaglandins, when they are around the cervix, they work to soften the cervix, dilate the cervix or widen it, and efface the cervix or thin it out. And in this way, if you're sort of on your way to labor, this could be a nice method to actually get you into labor a little bit quicker and a little bit smoother without needing to rely on anything like harsher induction methods of medications or manual manipulation. Now, sweeping the membranes is not always successful. It's only going to work if you're sort of already on your way to labor. It's most successful in people who are more than 40 weeks pregnant, or it's not their first baby, or like we said, you're already in those early phases of labor. And we do need to remember that membrane sweeping, or membrane stripping as others might call it, do come with its own set of risks because it's a medical procedure and no medical procedure is without them. Now, the risks or the side effects of a membrane sweep are going to be discomfort. It's going to be uncomfortable to have somebody's fingers inside of you doing sort of movements like this. It can also cause you to have some light spotting or some light cramping, and then a bigger risk of it is actually going to be accidentally breaking your water. And once your water is broken, we know that that takes you on a different path for labor and delivery. Now, you know that I'm an intensely visual learner, so let's take a look at this process up close and personal. This paper mache beauty is of course your uterus, and at the bottom of the uterus is your cervix. Now you can see that this cervix is indeed dilated, and inside this cervix is your amniotic sac, which of course contains your amniotic fluid and your baby. Now I have also made a little peep window in this uterus so you can get a nice look at what a membrane sweep would look like. So come a little closer and let's check it out. As I mentioned, it of course starts with your cervical check. So the fingers are going to go in and we're going to look for your dilation and your effacement of your cervix. And then once that's done, they're going to go a little bit further, and in this circular motion that we talked about, they're going to move their fingers like this all the way around the cervix to try to release that amniotic sac from the uterine wall. Now, if you look from this angle, you're going to see that right here, this is where that sac is coming away from the wall, all the way around. And in coming away from the wall, it's going to release those prostaglandins that we talked about. Now, if your membrane sweep is going to be successful, it's going to cause you to go into labor within 48 hours of the procedure. If you like that quick and dirty, go ahead and give it a thumbs up. Check out some other videos around here and consider subscribing, and I'll see you in the next video.